In this video, we are going to talk about what to expect when you are 32 weeks pregnant. We're also going to go over your baby's development, how you might be feeling right now, how to help with problems like back pain, and so much more. But first, if you're new here, my name is Diana. I'm a physician assistant and I specialize in women's health and gynecology. You're watching In the Pink, and if you're new here, In the Pink means in good health and spirits. So if you like being healthy and happy, click subscribe because you're in the right place. So at 32 weeks, your baby is about 3.5 to 4 pounds, and they're about 18 inches by now. And if your baby were to be born today, assuming that your hospital has an ICU, your baby will most likely do very well. They still have to stay in the NICU for a while, maybe a month or two, but they actually do really well. And in fact, statistically, if you were to look at two 5-year-olds, you wouldn't be able to tell the difference between one who was born at full term versus one who was born at 32 weeks. They actually do really quite well at this point, so you can take a deep breath of relief. Of course, you really don't want to deliver this early, but it's still nice to know. Often by now, the baby has moved to the head down position. This is called the VERTEX position. Now, if your baby still is head up or breech, don't worry or stress out about it. By the time you deliver, most babies, about 95% of babies, will turn by the time you deliver. And once your baby finds the head down position, they usually stay that way at this point. What they're doing is they're making the most of the small space that they have by snuggling their head into the bottom part of your uterus, giving more space for the rest of their body. In order to prepare for life after birth, your baby is practicing breathing. Only now, their motions are starting to change. So before, their breaths were really quick, short, kind of swallowing, breathing motions. But now, their breathing is starting to become slower and deeper, moving closer to what their breaths will be like when they are born, which is about 40 to 60 breaths per minute. Of course, they're not breathing air. They don't get oxygen from their breathing. They get that from you through their umbilical cord. Instead, they're actually breathing amniotic fluid, and just not breathing it, they're swallowing it as well. And then the kidneys will process that amniotic fluid and it excrete it in the urine, where it becomes the amniotic fluid again. So let's talk about why you even have amniotic fluid. First, it gives your baby to move around in the uterus, which helps to strengthen their bones and their muscles. And like I mentioned earlier, it helps their lungs to develop through the practice. It also keeps pressure off the umbilical cord, and it keeps them warm, and it acts as a cushion from bumps from the outside of the tummy. The uterus fills with more and more amniotic fluid throughout your pregnancy, with the greatest amount of fluid around 34 to 36 weeks. And then it starts to decrease, making room for your growing baby. So at 32 weeks, you are now in the 8th month of your pregnancy, and you only have 8 weeks left to go. And at this point, a lot of people start counting down, and then they're like, wait a minute, if I am 8 months, how come I still have 8 more weeks to go? I mean, it gets a little confusing. So I'm gonna break that down for you. So at the beginning of 32 weeks, you are at the beginning of your 8th month. So next week you will be 8 months and 1 week, and then 2 weeks, and then 3 weeks. And then when you are 36 weeks, you will be starting your 9th month. But to get to full term, you still have to go through your 9th month, 9 months and 1 week, 2 weeks, 3 weeks, and 4 weeks. And then that's what gets you to your 40 weeks. Does that make sense? And many of you are never actually gonna even make it to 40 weeks, and you're gonna deliver before your due date. But I hope that makes sense to help you understand where you are in weeks versus where you are in months. As for you, you are really gonna start feeling pregnant at this point. Pregnancy becomes a little bit less fun and a little bit more uncomfortable at around 32 weeks.
Oh, don't make me come in there!
Many women find that they feel a lot more tired because they're not getting good sleep. It's hard to sleep when you're really hot. You can't find a comfortable position. Maybe you're a back sleeper like me and you can't get comfortable on your side. Maybe you're getting up to go pee multiple times in the middle of the night, and I'm not gonna lie, these last few weeks get a little bit tougher, but you got this, and when all's said and done, it is so worth it. So let's talk a little bit about back pain. And there are a lot of different causes for back pain and leg pain when you're pregnant. There's lumbar strains, there's sciatica, there's symphysis pubis pain. But in general, when your tummy gets bigger, it shifts the center of gravity forward. And so that you don't fall forward, your body naturally adjusts by leaning back. That makes the curvature in your low back exaggerated. It makes it bigger, and that can really leave your back achy and tired. And on top of that, the same hormones that your body is releasing to relax the ligaments in your pelvis so that your baby can pass through your birth canal during labor, those are the same hormones that relax your pelvis that causes pain. So here's a few things that you can do to help. First off, think about what you were wearing on your feet. So avoid high heels because that just shifts your center of gravity even more forward. Consider getting a maternity belt. And there are lots of variations of maternity belts. They can strap over your shoulders, they can go around your belly, they can go over your belly, they can go in between your legs, or they can be just as simple as this one right here, which I wore with all 4 of my pregnancies. Belly bands can help stabilize your pelvis, and they can help evenly distribute the weight of your enlarging tummy, which might help reduce pressure and aches and pains. And I will link to a few of them in the video description down below. Check them out. I mean, there is some evidence that they can help you with pain. When you sleep, sleep on your side. And at this point, I really recommend that you put a pillow in between your knees. This offers a lot of support to your hips and back. You could either buy pregnancy pillows like this, or you can just fold up a regular pillow and put it between your knees. Honestly, whatever is the most comfortable for you. Be sure to be engaging in physical activity. Now, I'm not talking crazy, strenuous workouts. Now is not the time to begin training for a marathon, but with your OBs okay, you can do walking, water exercises, which I personally loved because the pool takes the weight off your belly. You can do stretching and yoga. All these things help to keep your core strong, which helps reduce aches and pains. Be sure to be careful with lifting things, and this includes your older kids if you have them. So for my last pregnancy, I had a 1-year-old that wanted to be held all the time, and it's hard, I get it. I did a lot of sitting and then scooching my toddler up on my lap. Just do the best you can. Just be aware and avoid lifting with your back. Only lift with your legs and ask for help if you need it. Now, if you have to do a lot of standing, make sure to focus on good posture. If you are standing in one place for a long period of time, like for your job, try getting a low stepping stool so you can rest one foot on it. Be sure to rest frequently and also make sure that your shoes have good arch supports. If you are dealing with pain, you can use heat or ice packs on your low back to help alleviate the pain. Now, I want to point out there are other things that can cause pain in this area besides just the typical aches and pains of pregnancy. So you could have kidney stones that could cause back pain. Kidney infections can too. Gallbladder disease can cause pain that radiates to the back. Bladder infections, contractions. Some people feel contractions in your back and not in your tummy. So if you are having severe pain, or if it's just different than what you've been experiencing before, be sure to talk to your OB to let them know what's going on. Don't just make the assumption that all pain is just typical pregnancy pain, okay? Be sure to be drinking lots of water because dehydration can cause your uterus to contract. And we'll be talking about Braxton Hicks and contractions in the next video, week 33. So be sure to hit subscribe and also hit the notification bell so you won't miss when that video comes out. Also, be sure to be doing your kick counting. And if you don't know what that is, I talked a lot about that in week 28, 29, and 30. So again, if this is your first time here, I highly recommend that you go back to some of my earlier second trimester videos. Go check them out. They really have a lot of good information. I can't cover everything in every single video, so I break it up and talk about what's important and what's going on each week. But check out some of those earlier videos, and I will actually put a link to that playlist right here. Click on that and I will see you over there. So one more thing that I wanted to point out. Most everybody that's been watching these week by week pregnancy videos are pregnant, which means all the people that are commenting down below are going through the exact same things that you are. And one thing that I wasn't expecting that has made me so happy is that I'm seeing you guys offering support to one another. When you guys comment about questions or concerns or just things that you're going through, you guys are all chiming in and offering support to each other. And I wasn't expecting that. And I cannot tell you how amazed I am. And so I encourage you guys to continue to do that, to read the comments of other people going through exactly what you're going through right now. Support each other, talk to each other, because you're all here doing this amazing, amazing thing. And you guys can be there for one another. So thank you from the bottom of my heart for your support to each other. And keep it up. Their fat cells are now helping to keep them warm. Now, something cool that we've learned is that the baby's eyes can now track light. And one of the ways that we know this is that their irises will dilate and contract depending on how much light they're seeing.